Hello everybody, I'm wanting to chat to you today about doing a breast self-examination, a BSE. You can go for a clinical breast exam on an annual basis when you go for your pap smear, for example, so that your doctor may have a good record as to any changes that might be happening in your breast. But it is also recommended to do a monthly exam on yourself so that you can get to know your body. There was a study done in about 2008 where they no longer found it beneficial to do monthly exams because they found no correlation to survival rate, and they found that it led to unnecessary procedures and testing such as biopsies and removals because of the anxiety that it built up. Nonetheless, many professionals still find it beneficial to get to know your body and to understand what is it that you actually have to do and what it is that you are looking for. So in light of all that I've just been through, I wanted to answer some of your requests to learn how to do a breast self-examination. You're going to do two things. You're going to both look and you're going to feel your breast. You're going to do it in lying down and you're going to do it in standing up. It is best to do so if you are menstruating about 7 days or so after your menstrual period, because then your breasts are likely not going to be tender anymore. If you are no longer menstruating, then it's beneficial to try and make it as regular as you can. So on the 1st of every month, 15th of every month, or the 30th of every month, whichever is more suitable to you, and something that you're going to remember. So what we're going to do is, in standing in front of a mirror, so imagine at your basin, and with your mirror in front of you, you're going to put your hands into your hips and push firmly. You're also going to keep your hands down at your side. You're going to put your hands up in the air, and you're also going to lean forward. In these positions, you're going to be looking for any changes from right to left breast, any changes from this examination to the previous examination. You're going to be looking for dimpling of the skin, any redness, any obvious kind of areas of soreness, any, they call it like an orange peel-like skin. You might notice a lump in itself. You also want to then go to your nipple and you want to give it a good firm squeeze and notice any secretions that may be coming out from the nipple, and these would typically be bloody or milky or almost like pus, and this would then be brought to your doctor's attention. Another part of what you want to do is then the palpation. So in palpation, you might be in the shower, you might just pop some cream on yourself just so that it's easy for your hand to move over your breast. You're going to be feeling with the first 3 fingers, and you're going to feel with the pads. You don't want to poke anything, you want to feel nice firm pressure. You're going to be feeling superficially medium pressure as well as deep pressure. The pattern that you're going to use is a little circle. In those little circles, you're then going to move with those little circles, and you really want to take your time. There are 3 different patterns that you can do, and you're going to use the opposite hand compared to the breast that you're working on. So you can do almost like a zigzag, going up and down, all the while doing your little circles. You're wanting to make sure that you're covering the entire area, from your collarbone, down your sternum, underneath your bra, and all the way up into your armpit. So you're going to do these little zigzags. Then you can also do what people refer to as like a pie. You're going to go from outside in, all while doing little circles. Not so good with my left hand. Okay, and then you can start at your nipple and work like a spiral going outwards until you have covered your entire breast. They tell you to do this because they want you to be systematic so that you can cover all the tissue that you're examining. So if you're in standing, you're once again going to do this in a couple of different positions. You can do it with your hand at your side, your hand at your side, your hand on your hip, and you can do it with your arm in the air so that you are covering as much of the tissue as possible and getting to different depths. Remember, you're still doing this superficially, medium pressure, as well as a deep pressure. In order to get a bit deeper, they also advise you to try and do it lying down. So in lying down, you would put your hand either on your forehead or behind your head. In this position, then you want to, once again, let's say, for example, you're using that zigzag motion. You're going to go right up into your armpit, right down towards where your underwire brow might be, and you're going to be doing little circles all the while, focusing on shallow, medium, and deep pressure so that you can really get into the deeper part of the breast. So this allows your breast to lie a little bit flatter, which makes it easier for you to examine what it is that might be going on. with this examination, this palpation, you're feeling for any tenderness, and you're feeling primarily for lumps. It's what everyone's anxiety is all about. So a lump that has changed from last month to this month, a lump that is in the one breast that's not in the other breast, that type of thing is what you're looking for. So you might find a lumpy region or a fibrocytic region of your breast, and often it's different from right breast to left breast. Then you might find an actual lump. If it is a problematic lump, it is more likely to be fixed and adhered to the area that you are examining. But either way, you would then bring this to your doctor's attention at your next visit, or schedule a visit to ease your anxiety and rather have a professional have a look at what's going on in your breast. If I were to show you exactly what I found in my breast, so it's a mobile lump. It is quite large. When I say large, it's like almost like a golf ball size. So if I were to show you what is going on in my breast and what I found, well, what my GP actually found, it's a more or less a golf ball size lump, which is mobile, which is fantastic. The reason that we went for testing is because it had grown quite rapidly, and also because there was tenderness up in my axilla. So this then kind of signified the need to do further testing. This testing would then be most likely an ultrasound, a biopsy or mammogram, and sometimes blood tests, and you might be referred to a specialist to investigate further or advise you as to what might be best for you, if the lump needs to be removed or if it's safe for it to stay exactly where it is and just be monitored. So I hope you found this helpful. If I were to show you my lump through my t-shirt, it's almost, I can kind of pick it up with my fingers and move it around. If I were to try and show you, it's more or less there, and you can kind of see it bulging out over there. So it's quite an obvious one. So there it is. So I hope you found this beneficial. I encourage you to share this so that other women may also learn how to examine themselves properly, whether or not you do it from a month-to-month basis, which I think is beneficial, or if you just do it on a random irregular occasion. It's best to know what is going on in your body.